Hello, I'm Dr. Sugar, your internet doctor, here to give you your dose of medical inspiration for the day. We're continuing on with our topic of trigger point injections. So I'm actually going to demonstrate a trigger point injection for you now. My friend here does not have fibromyalgia. She has a chronic pain syndrome, myofascial pain, where she experiences a lot of muscle pain, muscle tenderness, and those taut bands of muscles that we were talking about in our last video. So in general, Lynn has had good results from trigger point injections in the past. She's had this done before, but I'm just going to pretend like she hasn't, so I'm going to talk through this a little bit more as if she were a first-timer. So I always tell my patients that there's some risks associated with trigger point injections. The risks are, of course, bleeding. There may be a little bit of bleeding, usually not much, but if there's bleeding involved, that's something they should be aware of. Anytime we insert a needle into the body, there's also a minor risk of infection, and also risk to damage of the surrounding muscles or damage any of the surrounding organs or tissues. Most importantly, in the area that we're doing today, Lynn should be aware that there's a very, very minor risk of actually puncturing the lung. I've never seen it happen. It's certainly never happened to me, but theoretically that could potentially happen. We use very, very tiny needles. If any of those things did happen, the patient would of course need to have further treatment done. But overall, trigger points are very, very safe. Now, one other thing that I didn't mention in my previous video is that once we find these taut bands of muscles, there's one other thing that can be done before the actual needling of the muscle, and that's called stretch and spray. And it's where you have a spray that is a very cold spray that can be sprayed on the muscle, and the muscle can be stretched by the provider, by the doctor, and some people have pretty good results with that as well. But we're going to jump right in and do the trigger points today. So as I mentioned, what we're going to do is palpate along the muscle line, and my patient is going to indicate to me where it is that she has the most pain. Right in here? Okay. Now again, I'm feeling a taut band of muscle, so she does have some muscle spasm in this area. So I identify that area, clean it with a bit of alcohol, and then going into this area with the needle very gently. You're going to feel a poke there. Now, I'm going to lift this muscle up just to protect that lung. And then, as I mentioned to you, this is called needling the muscle. So I will go in with the needle, and my patient will tell me when she feels the most intense pain from the needle. Occasionally I will feel a spasm right there in the muscle, or a twitch in the muscle, and injecting just a little bit of medicine. And again, injecting just a little bit of medicine into that muscle, making sure that we got the medicine into that part of the muscle that had the twitch response or the most intense pain for her. And as you can see, very safe, no bleeding whatsoever. Did that hurt a lot? Very little, if any, pain. So we're going to go along the back here and see what else we have. Okay, so this muscle up here, we injected into her trapezius. I'm going to inject now down into her rhomboids, which is by the side of her shoulder blade. Poke. And if you'll bring your arm across over there, that opens that muscle up just a little bit. And I felt a nice little twitch response there, injecting a bit of medicine. And again, just seeing if there's any other areas that have extreme pain for the patient. Very nice. How's that feel? And again, absolutely no bleeding, very little pain. And your doctor can choose to do these in a number of areas, both sides, a lot of muscles in the shoulder and in the upper back, in the low back, in the hips. I commonly do injections into the hips. And then I just massage the muscle a little bit, spreading this medicine around. And then what I'll do is advise you to go home when you're finished at the completion of these injections and get heat on this area for about 20 to 30 minutes and just kind of take it easy for the rest of the day. All right? Now, in terms of your pain, on a scale of 1 to 10, what was your pain when you arrived?
About 8.
Okay. And have you noticed any significant decrease? What would your number in your pain be now?
Half of.
So her pain just immediately in the initial time that it took to get the trigger points has gone from an 8 to a 4. That's pretty significant. I would expect that she may have a little bit of soreness today, but that tomorrow her pain would decrease even more. And if she's has good results from the trigger point injections, it may stay at a low level, say a 1, 2, or maybe 3, for 3 or 4 weeks before she would need to come in and have trigger point injections again. So I'm Dr. Sugar. I really appreciate you watching these trigger point injections with us today. And if you haven't already done so, be sure to watch our entire series on fibromyalgia and our entire series on pain. There's some very good videos in there that I'm sure you're going to enjoy. And for any of your medical questions, go to our video content library and check out our entire library of medical videos. I'll see you there.
Sugar.